So we're here today with Christy Turlington, model and founder of Every Mother Counts, an organization devoted to making pregnancy and childbirth safe for all moms. It's great to have you here, Christy.
Thank you.
So tell us a little bit about why maternal health is so important to you.
Well, I became a maternal health advocate when I became a mom, which was a little bit over 10 years ago. But I also, in addition to just becoming a mom, I actually experienced a childbirth complication after delivering my first child, which is what sort of opened my eyes up to a global tragedy, which is that of maternal mortality. I wasn't aware when I became a mom or when I got pregnant that women continue to die in the 21st century. And what I learned after the complication, trying to understand why what happened to me did, there really was no explanation, is that hundreds of thousands of girls and women die every year from pregnancy and childbirth related complications. And that the good thing, which got me really inspired to do something about it, was that 90% of those deaths are preventable. And I started, the more that I learned, the more that I felt like I had to know more. Right. And at every turn, it kind of kept presenting itself as this is the thing that I need to focus my time and my energy on. When I was pregnant with my second child, I traveled to El Salvador, which is where my mom is from, and I'd grown up traveling there quite a lot. But of course, in that part of the world, a lot of women are particularly vulnerable when they bring life into the world. And so being there, being pregnant, being in my mother's home country, it kind of just hit me that this was going to be the thing that I was going to dedicate my time to. And what resulted from that really was a documentary film called No Woman, No Cry, which I made from sort of 2008 through 2010. And we sort of traveled around the world examining barriers for women to access health care at critical times in their pregnancy all over the world, but with a focus on the US, Bangladesh, Guatemala, and Tanzania. And after that was done, I thought sort of that would be my big contribution. And then it's like I couldn't stop. Once I started to travel around the world with the film and meeting people, talking to people when I became part of a different community. Mm-hmm. And that's just continued to fire my passion and has sort of evolved into Every Mother Counts, which is, a campaign essentially, but one now that we support a number of programs all over the world, sort of addressing barriers, again, to women accessing healthcare, and many of those are really about accessing the right people and the right supplies at the right time. Mm-hmm. So transport is a big focus of ours, and we do a lot of initiatives and sort of fundraising around transportation. And then others are education, training midwives and skilled birth attendants so that more women have access to someone who can identify complications before they arise or address emergency situations when they occur. And then dealing with supplies too. A lot of times if a woman has access to care, and even if healthcare is free, which it is in many impoverished countries, they get there but they don't have supplies. So they're expected to have blood, they're expected to have cotton, they're expected to have the simple things that most of us just get and oftentimes just go into the bin after we've had our babies. They don't even use them. So there's such a discrepancy between those who have and those who have not, and we're trying to bring those two worlds together.
Yeah, the film, the part that we saw at lunch was really, really moving. Can you tell us a little bit about how you made it, where did you go, and some of the stories that you heard?
Sure. Well, I had the idea to make the film when I was in Peru with the organization CARE. And I'd seen a great program that they'd worked on in partnership with USAID and the approving local government, where they looked at an area called Ayacucho, and they reduced maternal mortality there in half, and it had these very, very high rates of maternal mortality. And they sort of took me around and showed me how they were able to do it, and none of the solutions were very complex. It was things like having a 24-hour referral service so that the clinic was connected to a hospital that was a few hours away, but at least they would be able to send transportation or receive someone and be prepared for an emergency scenario. It was, allowing women, Indigenous women, to deliver the way that they traditionally do, without judgment and without, disrespect. Mm-hmm. Things like having floral sheets rather than white sheets, which for this Indigenous population represented death. The flower sheets were just something to warm it up, to make the environment more comfortable, to allow them to have their families present. In a lot of countries where they have a more medicalized system, the family sort of got shut out. And I think now, even in this country, there's sort of more of a trend to sort of bring members of the family back in, but it went so far extreme the other direction that a lot of countries sort of followed that. And so, for a woman to be able to deliver standing up if that was the way that she felt that she wanted to, and to have her family. I mean, there were farm workers in Peru that deliver in their full clothes with a hat, the whole thing. Incredible. So just being respectful of the community that you're in, because communities change, and there are lots of very individualized concerns and sensitivities, and healthcare professionals kind of can't come in and dictate how things are going to go. You really have to work with a woman and meet her where she is and find the best way to make her comfortable so that she'll have the best outcome. So that sort of conscientious care. And making No Woman, No Cry, we came across that in every country where we were. We approached and met the moms who are featured in the film through different ways, mostly through programs or clinics. So in Tanzania, we met Janet, who we saw today, a small government outpost which has no equipment, no nothing. You saw the room. It's so, like, there's just the bed, that's it. Right. And there's not the space to care for women. So if a woman comes in and nothing's happening in that moment, they send her away. And the message to that woman is, don't come back, we can't help you. So, Janet, if we hadn't been there, would go home, and then she would just sort of pray and hope that things work out the way, the right way. Right. But with very little intervention, and a lot of times the nurses are the ones who come together to put their money in to give them a ride or give them some food. So it's little things. I mean, thinking about, a lot of people think right away, oh, so you need to have emergency obstetric care. It's got to be doctors. It's got to be hospitals. And it's not always that. I mean, sometimes you find that there's an overcrowding that happens in hospitals where you're in a country and you have a very straightforward birth. You don't need to be in that hospital. So you need to make sure that the clinics are mother-friendly, and that the people who work there are trained to be able to handle a pretty comprehensive amount of healthcare needs, so that they only really refer when absolutely necessary, because the receiving end can't always handle that many women. And to go an hour away from your home and then to be sent away, that just, they're already way below the poverty level, but that just puts them to a very debilitating place.
How about in the U.S.? Does the high C-section rate contribute to some of our maternal health issues?
It definitely does. In the last 20 years, we were able to get the numbers down quite low. In the 1930s, we had numbers of maternal mortality that were on par with sub-Saharan Africa. And so in a relatively short period of time, with the advent of very simple things like germ theory, understanding about gloves, washing your hands before you deliver. There was a time where doctors would handle a cadaver and then they would deliver a baby and not wash their hands. So we were creating a lot of the problems that existed in terms of infection. Now, I think the pendulum has swung so far that so many medicalized births, so much intervention, not allowing for women to have this very natural experience, take its time and be patient with it. I mean, supervise, but not get involved unless you need to. And I think most people that are trained in a traditional medical system tend to only think about what could happen, and they want to minimize risk, which is good, but it often will lead to other kinds of complications. So we're really trying in the U.S. to educate people more about this happening. People think, oh my God, I can see how it happens in other places, but not here. And that it really isn't. I mean, low-income women are more vulnerable, but they're not the only ones who are vulnerable. It really can happen to anyone. On a regular basis in my city, I'll read in the paper that there's a death at NYU, or there's a death at Montefiore, and they're good hospitals where things go wrong. Providers aren't trained to deal with emergencies, and so sometimes when an emergency happens, you have to move so quickly, and they just don't know how to do that because it's rare. So there's a lot that can be done, just even in places that are doing a very good job normally. But just the mindfulness that opting for one procedure might make you more vulnerable to other risks after the fact.
What other women's issues do you think are underreported on?
Well, it's interesting. We see that there's such a correlation, obviously, between education, I mean, internationally, but also here. I mean, girls and women who are educated more are more likely to delay pregnancy and delay marriage, which is better for most women. There was this report, the Shriver report, just a week ago that talked about how the majority of American families now are single families, and they're mom-run families, and a lot of those women don't have the support and are, it just to make ends meet is just an incredible burden. So I think sort of that level of awareness is really needed. just very basic support. And then domestic violence is another big thing. There's a lot of women who, when they say that they're pregnant, the first thing that happens is they get beat. And that doesn't come up as much in this whole debate around reproductive rights. It's like, you are vulnerable, if you're not choosing and have the support coming into motherhood, and let's have a baby now, let's save and let's provide for our child and our family. Women are entering this experience, which should be a very empowering experience, in a really, really dangerous way. So just making that link with domestic violence is, I think, really important. And then other things, nutrition, obesity is a big factor. So when we think about the growing rates of obesity in this country, that's having an impact, because it's making it so that a woman has to have a cesarean section. Right. And the babies are larger. And so it just puts her at a different kind of level of risk. So you want to make sure, as best you can, that young women and adolescents are getting education early, and it's comprehensive, so that they can start to prepare and plan and protect themselves, so that they are in a place, hopefully, when if they choose to become moms, where they have some stability, and that these other factors aren't as likely to impact the health of them and their children.
And how is the work that you're doing now in contrast to the environment in your modeling days?
I mean, it couldn't be more different.
Right.
The only thing is, because it's been an evolution, and I still do model from time to time, and a lot of the companies that I worked for over the years are very loyal to me and have been great and very supportive of Every Mother Counts and what we're trying to do. So it's kind of not separate, really. And yet also, I grew up traveling the world in my profession, and that ability to travel into the world gives you a huge perspective and a sense of what's happening in other places. And it's also a very international community. Like, my industry is very diverse ethnically. And so there's already kind of an understanding of, like, in my country, in such and such's country, the situation is like this. And now I've had an opportunity to have economic freedom and independence, and so now I want to be able to do something, whether it's for my country or my community or whatever. So it gives you a certain platform and a certain ability to be able to do something further than you might otherwise, I guess. But I really think that sometimes the sense is that it's just a very superficial industry, and actually, as a community, it's a pretty powerful one. I mean, when you think about the galvanizing that happened around, or mobilizing around HIV/AIDS, or breast cancer, or ovarian cancer, I mean, the industry has raised millions and millions and millions of dollars, and they continue to be one of the strongest funding groups or donor groups. So I feel like that was always very inspirational, what is possible amongst your community, and it could be any community, but it just happens to be a very big and very fortunate one.
Did you have any mentors in the industry who helped you think this way?
Not any one in particular, but there were always examples. I mean, when I think about someone like Donna Karen, who's very philanthropic and early on had some health summits. She has this foundation called Urban Zen, and she did a very big, like, week-long seminar, which she totally paid for, and invited healthcare providers and people to come for free. Like, that's something that someone like her could only do, and that was really incredible. Other models, actually, early on I got to meet Lauren Hutton, who was one of those people who said, just early on, if you travel to a country, spend more time there. Don't be rushed, spend time. And I grew up with parents who traveled a lot, who worked for the airlines, and so and my mom's from outside of the US, so I had a lot of that exposure, but that advice really helped me, because you're young when you're in that career, and you think that, it's all going to be over quickly, so you try to take every opportunity, and you're rushing around, and you're not having the time to really be present in those countries. And I really took that advice to heart, and I stayed extra days, extra weeks sometimes, if I had the opportunity to be somewhere far. And to me, to be in some place new or really rural, or the more different, the more exotic and interesting and fascinating for me. So I still try every opportunity I can to go.
So you seem like you live a very healthful lifestyle. What are some of your first principles when it comes to living a happy, balanced life?
Yeah, I think following your dreams in the sense of, what will make you happy, and that sometimes takes trying a lot of things. Yeah. I was in a position early on, because of my career and early success in a career that I didn't really choose per se, to be able to try a lot of other careers. I feel like I wear a lot of hats, and I don't feel like I've ever been sort of stuck in one particular career. and that gives you such a great experience to be able to, try on some things if you have. But I know it's a bit of a luxury to be able to do that. I think also, having my family really was an incredible experience. Not only the births themselves, but every day I'm learning in a different way about myself and the world through these people, these new people that I help to bring in the world. They're my greatest teachers. I've been a pretty healthful and yogi for many, many years, right. Which it's a lifelong practice for me. But I would say my incentive in being healthy and well is very tied to my responsibility as their mother, and wanting to make sure that I'm around for as long as I possibly can be to see them grow and evolve. Balance is a weird word, but I like the idea of integrating. If you can prioritize what's really important and meaningful to you, then, there are some days where it's less so, but for the most part, I'm doing all the things that I love to do every day in some way, shape, or form. And I think if you could just even do one of those things every day, I think it's a practice, you have to work at it.
How do you raise compassionate children?
I think the best way to teach anyone is by example. And it's less the words that I have for my kids. And at this point, my almost adolescent daughter is sort of like, yeah. But I think, for her to see that the choices I make are, I care about education, I care about other people. Those are the things that she's going to take away. I hope that if she ever describes me, it's like, my mom is a compassionate person, my mom is a generous person. I think that's what I hopefully would want to instill in her. And then at the end of the day, I feel like you have to make those choices by yourself too. It's not like you just wake up one day and you kind of know how to be a citizen of the world. I think that also takes a bit of trial and error. And it feels better to be that kind of person. So I'm hoping that I'm setting that kind of example, but they're in a school where social justice is very much a part of the curriculum, and that also creates a community around them where they're not the only one who's thinking that way. They're really in a community that believes in taking care of our others.
And if people want to contribute and get involved with Every Mother Counts, how can they?
Well, our website is really our best sort of way to get involved. We offer a variety of, we'll explain a lot about the programs we have, the 7 programs that we are supporting now, and then the different ways that each of our events or partnerships through companies that we work with, how those tie to those programs. 100% of the money that's raised for us goes to those programs. And that's a great feeling to know that we can guarantee people that their money isn't going to go to anything else. We're able to get support through other partners, which we also are very fortunate to have. Our website is really the best place to go. We have different focuses, every month or every other month. And it's a lot of sharing because we make a lot of films and things. So it's a lot of sharing the stories through those assets. But then it also could be around Mother's Day we do a lot, or we've done cell phone drives so that we can get cell phones into the hands of healthcare workers, or supply drives for women who don't have supplies and medical simple medical tools in different countries. So we do things and we try to mix it up so that people can find their way and their way to contribite.
Last question is, are you leaving a trail of babies named Christy as you travel?
Oh, I don't know. I haven't had a baby named Christy yet.
Really?
On our crew, it was a boy, it was named after a boy, and we had local film, we sort of hired local people as well. So Faraha, Janet's baby, was named after him, and we worked with a public health woman also based in Tanzania, and they named their child after her, McCrane. But yeah, it hasn't happened yet. I keep wanting to deliver a baby. I'm always like, I've got my gloves, and that hasn't happened either. Right. Sort of like waiting for a watch pot never boils. Whenever I'm there ready, the baby's not coming.
Great. Well, thank you so much for your time. It's been an honor to talk to you.
Thank you so much.